So here's the challenge that we often hear is once patients come and they have the scaling and root planing done, science is showing us that 21 to 60 days later, that bacteria is right back where we started. So how can we do a better job of controlling the bacterial load in the mouth and giving our patients the tools they need to actually reduce bacteria? What kind of antimicrobial products do we have? Because that's an important part of the puzzle as well, isn't it?
Mm-hmm. All right, so as a healthcare provider, one of the primary goals is to enable your patient when they leave your office. You've done great scaling. The hygienist or the doctor has gone in and really spent a lot of time to reduce that microbial load so that the tissues can then be as healthy as possible. What are you going to give them? What are you going to do so that when they go home, their oral health is as clean or as optimal as when you kind of left them? That's really what we're talking about.
Yeah, and over the years it's been quite challenging, to be honest, because the gold standard that we've used for so many years, usually a chlorhexidine-based formula, has been proved by science in recent years to not be as effective as we once thought.
Which is kind of a bummer, because chlorhexidine in and of itself, great compounds, right? Great structure, very dependable, but unfortunately some of the science is showing us that over time, bacteria have decided that they don't want to be taken out of the equation, so they've created a mechanism or ways in which they can form protection against it. So the bummer is it's not as effective as we had hoped.
Right, and there was a study actually published in the Antimicrobial Chemotherapy magazine that actually broke down the study, and really what they found is chlorhexidine's resistance is stronger when we're dealing with bacteria in the state of a biofilm. And what we know about biofilms is very complex, and we're going to go into that. But the reality is, when bacteria is in a biofilm, all of a sudden chlorhexidine has lost its impact, ability to have a big impact on the bacteria themselves. Mm-hmm. And the other thing about chlorhexidine that was published recently is that the whole purpose of the body when we do scaling root planing is to help the body heal and regenerate new fibroblasts, and chlorhexidine has been proven toxic to that new regeneration. So chlorhexidine has just been shown to be toxic to fibroblasts.
Which is really kind of a devastating piece of news for those of us in healthcare, right? Because you've removed some of the bacterial components that are there, but now they're starting to show that they can fight back, which is a bummer. And now we're finding that the agent that we thought was so great to send the individual home with or to use as a complementary regimen is actually reducing the ability of the new cells to get in there, be protective over time. So we need to have some other form or some other solution that we can give them that's as effective, if not better, over time. And that's really, I think, what we have.
Absolutely. And so the question really is, how can we embrace the science behind essential oils and teach our patients how to use these products at home, and what kind of an impact can we expect? And that's really what we're going to continue to explore here today.
Exactly.